Hospitals in KwaZulu-Natal are barely coping with the scores of COVID-19 patients. It's one of the provinces with the most number of active cases. Well, Tuba Velane is out and about. Let's chat with him, especially about reaction to what we heard last night. Tuba, a very good morning to you. With those hospitals under pressure, what's the general feeling now as we start living in lockdown level 3 once again? Are the medical professionals feeling a bit more relief after last night's announcements by the President?
Yes, that's what we're trying to get the understanding on UVECA. Where we are, we're outside Wentworth Hospital, just outside Durban. This is one of the hospitals that we understand has, for the past few days or weeks, has been overwhelmed by a number of infections and admissions. And we understand that that also affected some of the staff, as we were told that the number has been an increase of the staff that has also tested positive. And certainly there are a number of staff that has also passed on at this hospital. But I'm going to speak to the Provincial Secretary of DINOSA, Mandla Shabang, to understand more about the situation at this hospital and to get their reaction on the President's speech last night. Babu Shabang, thank you so much for your time. Just firstly, let's talk about this institution where we are now. I understand you were telling me about the current situation. How bad is the situation here?
Good morning, Tuba, and your viewers at home. The life is bad in this hospital. The situation is getting out of control since the beginning of December. This hospital has been experiencing a lot of positive cases when it came to staff and patients, and you find that many healthcare workers are on isolation or quarantine, and there seems to be no plan of replacing those who are on quarantine. At some stage, you find that a ward full of 55 patients will be nursed by 2 nurses. And that is creating a serious strain because some of these patients, you find that they are positive, some are PUIs. They are just mixed all over because there is no capacity to hold either from human resource or from the staff that needs to be specifically dealing with positive cases. The situation is dire in this hospital. And you find that it seems like management is also confused. They don't know what to do because they seem not to have a plan of how to deal with the high rate of healthcare workers who are on isolation or quarantine. So those who are coming to work now, they feel strained because there's a high load of patients who are coming here without getting support from management. Nurses are really not coping in this hospital.
Last night, the President addressed the nation, and one of the things that was expected and indeed he touched on is the issue of vaccine. What is your view on the delays that the President spoke about on the issue of vaccine? Don't you think we should be prioritizing these healthcare workers that you're talking about here?
It is very disappointing to learn that the President is telling us about the second part of the year where they might start distributing this vaccine, because to us, we think for a state to protect its healthcare workers should be a priority, because without these healthcare workers, the health system will collapse to its knees. Now, we are observing this attitude of the President and its administration that when it comes to healthcare workers, they seem to be taking a backseat in prioritizing their health. Instead, they keep on having this rhetoric that they are heroes, they are our heroes, they are this and this, but their action does not show that. Because if the state was serious about protecting its healthcare workers, they should have done all the means to get the vaccine, especially to first give it to the healthcare workers so that the public can be assisted by people. Now you are finding a situation where there is no plan at all in dealing with the infections that are increasing on healthcare workers. But the same state is allowing patients to flock into hospitals without anyone assisting them. You find people dying on stretchers because they are waiting for beds. They cannot be assisted. There are no beds. There is no plan at all to deal with the issue of human resource which will assist our communities. We have a ground just down here in Clearwood. That stadium has been open, but there is no human resource to cater for those patients, so it is might as well not existing at all, because now patients are overflowing in this area. They are overflowing in Prince Msheni. At Prince Msheni, as I'm speaking to you now, all patients are rediverted now from all the private sector. They are coming to Prince Msheni and King Edward. Do we have capacity? The answer is no. There is no capacity at all.
Baba, very briefly, what are your plans in trying to engage the department? Have you tried to speak to the MEC or the leadership of the department in the province?
We have tried since last week the problem with the department is that they always want to hide behind being busy. Now, we have a situation where we keep on asking for their plan, a simple thing that, what is your plan on dealing with the second wave? We have not seen that plan. We keep on being told that there is a plan to deal with the second wave. But in our view, the department has no plan in managing the second wave. That is why you are finding so many healthcare workers being infected and so many are dying, but there is no plan to even replace those who have passed on. Those who are remaining behind are still expected to hold the fort. In the mix of the pandemic, they have not been given counseling, they have not been given their increment. The situation is bad.
Thank you so much. That was the Provincial Secretary of the NOSA in KwaZulu-Natal. He's talking about their attempt in trying to get the plan from the Provincial Department of Health. We will also be trying to speak to the Department of Health in the province to try and understand their plan as the province is facing the resurgence.
All right, thanks very much. Tubavelane there in KZN. Yes, and people coming to grips with what they have to do this morning, and it will take a while before, I suppose, our healthcare workers feel any kind of relief at the moment in dealing with this monster. We'll continue.